Hello,
Hello.
my name is Coral. I'm a student nurse with San Francisco State, and I'm going to do a head-to-toe assessment on you, okay? It should take about 10-15 minutes. You comfortable with that?
That's fine.
What's your name?
My name's Jake.
And what is your date of birth?
10/24/91.
Okay, so I'm going to perform a hand hygiene, and I'm going to put the curtain around and ensure some patient privacy, and take an overall general impression. So patient's posture is upright, hygiene is well kept, appears to be alert and oriented ×4. You know what day it is, you know where you are, you know why you're here. Okay.
Check out.
Yeah, great.
Yeah.
And as well as visually assess body and limb symmetry, color of skin, etc. Patient appears well nourished, developmentally appropriate, etc. So I will go ahead and inspect the face and head and neck, just like skin quality and for any apparent wounds or lesions or deformities. Okay, patient wears glasses. And then I'm gonna go ahead and palpate. So I'll palpate the cranium and just feeling for any lumps, deformities, injuries, etc. And then the sinuses, so the forehead, around the orbits of the eyes, the cheek, and the chin. I'm also gonna palpate the ears, so just let me know if you feel any tenderness or pain throughout any of this.
Okay.
So pull up, pull down a little bit on each side. And I'm gonna inspect the ears as well, pulling up, looking for any redness or discharge or swelling. And I'm also gonna palpate the lymph nodes. So we have occipital lymph nodes in the back. Any palpable lymph nodes would be noted. We've got preauricular, postauricular, submental, submandibular, superficial, cervical, supraclavicular, and okay, everything appears normal there. I am going to move on to the eyes. So, so you wear glasses normally, just for everyday purposes. All right. So I will assess Perla. I'm gonna go like this so that I can observe the consensual response of the pupil that I'm not stimulating with the light. And I'm gonna come in from the side. So pupils are equal, round, responsive to light. And then if you could focus on the end of my pen light, just as I come from far away to closer. So that's A for accommodating to distance. And in terms of, so that would be cranial nerve 2, and cranial nerve 3, 4, and 6 will be extraocular movements. So if you could once again focus on my pen light as I go, and don't move your head, just your eyeballs. All right, very good. So 3, 4, and 6 are intact. I'm also going to make sure to inspect the conjunctiva, pink and moist, and the sclera, white, so negative for icterus. And then I'm going to assess cranial nerves 5 and 7. So if you could close your eyes and just let me know where you feel.
Right cheek. Left cheek.
Okay, you can open your eyes. Can you give me a big smile and then a frown and then puff out your cheeks? So that's number 7 intact. And then can you shrug your shoulders up against this, okay, passive resistance, and then against my hand there, and then once again, and then just swallow. All right, so that's 9 intact, and then 11 also intact. And I'm gonna make sure to peek inside the mouth as well. So give me a big ah. And I'm just observing dentition, mucosa pink, gums, healthy, dentition intact, uvula and tongue midline. And so that would be cranial nerve number 10. You could as well. No pallor of the tongue, cranial nerve 10 intact. All right, so let's move on to some heart sounds, all right? So I'm gonna auscultate And I'm gonna go atrial pulmonic tricuspid mitral. And I'm gonna just go under your shirt. Is that all right? You wanna just kind of lift up your shirt?
Yeah, I'm gonna
for
take my
me?
shirt off.
No, that's okay. Okay. All right, cool. Thank you very much. All right, so S2 sounds are heard best up there, and S1 sounds are below. I'm gonna flip it around to the bell and listen for murmurs in the opposite order. All right. I'm gonna move on to lung sounds, and I will just carry on. I'll use the diaphragm, and I will carry on in the front. So, thanks again for doing that. And can you just take nice deep breaths for me? With your mouth open would help me.
Okay.
And every time you feel my stethoscope, okay, just take a nice deep breath. And then posterior. All right, very good. Lungs are clear to auscultation bilaterally. You could go ahead and lie down now, flat on your back. And I'm gonna assess the abdomen. And also, for the respiratory stuff, I also wanted to observe for equal chest rise bilaterally. All right, skin quality, obvious lumps or pulsating. And yeah, I will auscultate first, starting in the right lower quadrant, and I'm gonna move clockwise, and I'm gonna palpate. I'm so sorry. I'm gonna auscultate first. Okay. Okay, bowel sounds are very present in all four quadrants, and I'm gonna flip around to the bell, and I can listen for bruits. Or maybe not, but I'll palpate now, and that is what I'll do in the counterclockwise. So left lower, I'm gonna start light, and then go a little deeper. Actually, a little lower. Is that all right?
Yeah, that's fine.
So just let me know for any pain or tenderness. All right. So negative for distension, pain or tenderness. So now I'm going to perform a rebound test.
Mhm.
So you might feel a little bit more pressure or discomfort. So any pain on when I lifted my hand up?
No.
Okay, great. So I'll go ahead and lower that for you.
Thank you.
And I'm going to, you can stay lying. I'm gonna do some strength tests. So plantar flexion, you can push down against my feet. And then dorsiflexion, feet up towards, against me. All right, excellent. And I'm gonna remove your shoes if that's okay with you. Okay, thank you. All right, pedal pulses. They are regular and strong bilaterally. And can you feel where I'm touching? Okay, can you feel where am I touching now?
Left pointer toe.
Okay, and so that's sensation in the lower extremities. You can feel where I'm touching.
My right wrist.
Okay. You can feel that.
Left wrist.
So that's the radial pulses are palpated, strong, regular, and equal bilaterally. And go ahead and you can move, just sit on the edge of the bed now, please.
Okay.
All right. And push against my, okay. And then once again, push against this side. Okay, so that's 5 out of 5 for lower extremity strength. And then go ahead and stand up. And lift your arms away from you. Good. And then grab my fingers as strong as you can. Very good. So 5 out of 5 upper extremity strength. And let's perform a little balance test. So you can close your eyes. Very good. We're all impressed. But just stand like a soldier with your eyes closed for 20 seconds. Okay, very good. So negative for Romberg. And perform a little balance beam walk for me. Heel to toe, just forward and back. How far? Just a few steps. That's good. And you can turn around. So gait should be gait should be smooth. So neuro checks are all clear. And we're almost done, but you can sit on the edge of the bed again. And because I do want to palpate your carotid. So they're at a 3. You're in performance mode. And they're equal bilaterally regular. I can even oscillate for some bruits on the carotid. Okay, so that's negative, and maybe I forgot some stuff. Oh yeah, got to do cap refill, perfusion. So it should be under 2 seconds. Very good. I can perform it on the toes as well. All right. And that's gonna do it for me today. Okay, debrief. I forgot to ask Jake about his pain.
I hurt.
What, in what way?
I have a pain in my lower back right now.
Your lower back?
Yeah.
How would you describe it?
It's kind of like a dull pain.
On a scale of 0 to 10, where would you rate it?
Probably like a 3.
When did it start?
2 days ago.
Okay, does it radiate?
A little bit, kind of down towards my hip.
Were you doing anything that might have caused that to start hurting?
I'm not sure. It just I woke up.
Oh, okay.
Yeah.
And anything you're doing helping it out? Making it feel better?
Actually moving around kind of helps.
Totally.
Yeah.
Okay. All right, thank you so much.
Of course.
Addendum number 2 is that I should have mentioned cranial nerve number 12 being intact as I observed him stick his tongue out and wiggle it side to side.